Hello, guys, and welcome back. This is me, Hassan Abdurrahman, one of the FRCM Course Academy co-founder and instructor, and hopefully you are doing well. So today's topic, we are going to talk about the communication with an angry patient or angry relative in the emergency department, how to deal and what are the steps to handle such situation. So we are working in the ED, which is a very busy area, and we are expecting to deal with the different personalities and different types of characters. So we need to be prepared for that. That at any point we can meet a situation which is a little bit difficult to be handled, and we need to be prepared for that. And as well, we need to have a structural approach to face such a problem. Otherwise, things will be much more difficult and things can escalate badly. And our task here to de-escalate any problem that might happen during the shift. So I'm sure most of us as physicians, particularly as frontline emergency physicians, in a daily basis, I don't want to exaggerate, but actually in a daily basis, we are dealing with the complex, difficult patients. And they have different demands and they need optimal type of care. And they have specific expectations from the emergency department services. And if those expectations never met immediately, their response back will be in aggressive and in hostile manner. Different type of hostility. It might be verbal abuse, it might be physical abuse, it might be emotional abuse or anything. So in this record, I'm not going to talk about psychiatric patients or those patients or those angry people with underlying mental illness disease. Rather, my talk will be directed and dedicated to communication with angry people without any underlying psychiatric disease. So the approach for this topic, I'm going to divide it into three parts. Number one, pre. Number two, during. Number three, post. So I'm going to talk about each type of those sections in deep details. So this scenario, you might find it useful in your daily practice in the emergency department and for the exam purpose as well. So we'll start by the scenario that you are in the shift and you are the most senior one. The ED nurse, the ED charge nurse came to you. She mentioned that there is a patient in the triage area. This patient is very aggressive and hostile, and this patient had been seen and triaged by the triage team, but he became, unfortunately, very hostile. So now you are the most senior one, have been asked to go to assess the patient. So this is a scenario. We'll start our talk with this scenario. And now let's talk about the steps. We mentioned that the first category will be the pre-part. Pre-part is mainly about preparation. So we're going to divide it into this preparation itself, going to divide it into two categories. The first type of preparation in the pre-part, that you have to be prepared and you have to prepare yourself each time when you're coming to the shift, that during this shift, you will face an angry patient or difficult situation. So likewise, you will not be surprised. And as well, emotionally and mentally, you will be ready. So this is the first type of preparation. The second type of preparation, this happened when the act took place. This is applied after which the nurse told you that there is an hostile patient in the triage area. So now there is active angry patient in the triage. Now we are talking about real facts in front of us, and we need to deal with that. So let's talk about the second type of preparation. Here, those are the things you have to say to yourself while you are going to see that patient, while you are going to talk to that patient. What type of preparation? How can I prepare myself to talk to that patient? What is the talk? What is the conversation will be like? What are the steps for which I have to conduct it? So this is the second type of preparation. While you are going to see that patient, You have to say to yourself that I can handle this situation. It will be a difficult situation. This patient is extremely angry, but I'm capable to do this. And I'm going to listen to him or to her, and I'm going to address his or her concern. And whatever things have been said to me, I'm going to handle them. This patient or relative is angry for a specific reason. The patient is not angry from you personally or per se. This patient have a reason. So I'm going to figure it out. As well, I'm going to fix it and address it. He or she is very hostile, but I'm going to handle the situation and things will be under my control. And there are other important points in the preparation part need to be discussed as well. So here you have to make sure prior to approach your patient that there is no any immediate patient safety concerns. If there is any patient safety concern, this will be addressed first prior approaching to the angry person in the ED. And you have to make sure that as well that the department is safe. This will be done by handing over the emergency department to other colleague and informing them that you are going to fix a specific situation in a specific location in the ED. And the other thing, you have to gather more information regarding the events itself. So if there is any notes, you have to review all these notes, and you have to know the circumstances of the event, and then you have to invite the patient to the quiet private location. Regarding the invitation of the patient or to the angry patient to the calm private location, this will be discussed further as we're going through the records. And the last point, you have to be accompanied by a medical staff. Ideally should be a senior member nurse staff. So like this, you're going to prepare yourself emotionally and mentally by those two steps mentioned before. So the first step, that while you're coming to the shift. The second step in the preparation part, when the act took place. So here, this is the second type of preparation. So here, you will be prepared and you will be ready to face this problem. Why we are talking about all this preparation in the pre-part? Why all these preparation steps in the pre-part is important? For two reasons. Because if you do not do this preparation at first, you will face an element of surprise during the conversation. What I mean by element of surprise? Because if you are not ready, might be this patient or this angry relative or angry patient might talk to you or might say something which seem weird for you. Something wasn't expected from you. Something wasn't expected to be said to you. So as a result, you might have a normal human response, which is abnormal response. A normal human response will be that if someone point a finger on you, you're going to point your finger on him. If the patient shout on you, you're going to shout back. And this is called the normal human response because you are not prepared for that. This is the element of surprise. So here, the normal human response will not be justified here and will not fit the situation here. Instead, it will make it worse and things will escalate very far, and you are going to lose the rapport and things will go in a very bad direction, which is not our target and it's not our task in here. So this is the benefit of the preparation, that we are need to change the normal human reaction for any hostile person. So like this, things will be much more easier and will be much more faster, so you can handle the situation without any difficulties. Now let's talk about the second part, which is during. And during part applied when you already arrive to see the patient, while you are with the patient now. So during part, in this during part, when you approach to the angry person, First thing to be done, what are the steps for which we have to do it when we came to the patient? So first thing, you have to introduce yourself. That my name is Hassan Abdurrahman. I'm the most senior one in the emergency department. You can refer to me by my first name. You can call me Hassan. I think this is a good communication skills to start with, because it shows that you are a humble person and you came and you want to help. So first thing to be done, that you have to introduce yourself. Immediately followed by, I'm here to help you. I have been told that you have a specific concern and you're angry because of a specific reason, so I'm here to address all these reasons. So next, try to invite the patient or relative to the calm area. So there is an office there, so please, could we step there, me and along with the charge nurse, so we can help you. What is the target of this invitation? Why we are inviting the patient to the calm area? Because angry person in front of other people, particularly in the waiting area or the very busy emergency department, those patients will try to show other people how angry they are, and they will be affected by the reaction of other people. If the angry person saw that he got attention from other surrounding people, this might make him escalate the situation more and more, and he might get the feeling of control, and they have a power, which eventually will lead to more escalation, and the tone will go up, and they will be more aggressive. But despite though, still you can handle the situation in a good manner. So now we have one of two scenarios, one of two options. If the angry person agreed for the invitation, that's fine. So you can go to the office and you can continue your conversation with the angry patient. If they refuse, you have to continue your conversation, but you have to consider your safety, particularly if your first impression that the safety might be compromised, safety for you or for the staff nurse or for the surrounding patients. So consider the safety, it's very important. Next, immediately try to understand the reason for their anger. You have to explore the reason. And most people in the emergency department, they have specific known reasons for which they became angry. Left without being seen for a long time, waited for a long time in the holding area. They didn't receive the result, the lab result. There is a delay in the lab because they're waiting for the relative to have the result, so they cannot wait anymore. So those are the reasons. They don't know what to do. They don't know what is the next step in the management plan. And the last point is very important, because unfortunately some physicians, they are not including the patient or the relative in the management plan. So the patient have been seen and they don't know what the next step, what they are waiting for. So there is no shared plan between the physicians and between the patients and the relatives. And this is very cardinal point. So if you have a good communication from the start, things will be much more easy than this. So you have to share the plan and share the management steps with your patients. So next, try to understand the reason and explore the reason of the anger. How can I help you? What is your concern? Help me understand the reason of your anger. Please tell me what happened. Help me understand what is your biggest fear. All these phrases can be used here, because our task and our target here to understand what is the reason of their anger. It is very important, because this will be the base of our conversation, how we're going to handle the situation. Knowing the reason, so we can answer back, so we can fix the problem, because now we understand the main reason for their anger. Right. I want to mention another point, which is a very important point here as well. So now when you came to see this patient, you don't know the reason why they're angry. And I will change the scenario. If the nurse told you from the beginning that the reason of this conflict, and you know the reason, that this patient was waiting for a long time without being seen and became angry and hostile. Still, despite though you know the reason of their anger, I'm still recommending to hear this reason from the hostile person by himself or by herself, and to confirm it. Because you know the reason, but you might discover something new here. So my recommendation to ask them again, despite though you know the reason. If you don't know the reason, that's fine. You're going to start as usual. But despite though, if you know the reason, confirm it back. Now they start to tell you the problem. They start to talk. Now we have to do the most important step in this situation, the most important factor for which the conflict can be handled and the problem can be fixed, which is an active listening. Active listening. What is the meaning of active listening? So active listening is the way of listening and responding to another person that improve the general understanding and show the full concentration of what's being said to you rather than just passively hearing the message of the speaker. So this is the active listening. So we have to understand this point and we have to demonstrate it in a professional way. And believe me, all angry people in the emergency department, they just need someone to listen to them. Once you demonstrate an active listening, things will be much more better. Because while angry persons start to talk, they will just start to release all the anger inside their chest, all the heaviness inside their chest. And while they are talking and you are demonstrating an active listening, this will add much more release to their anger. And now you have another positive point, that now you know the circumstances of the event. You know the reason of their anger. And you know how to respond back. And you know what to do in the next step. And before going to the next step, I want to mention that while you are demonstrating this active listening, try to not be busy by anything or by someone surrounded you or by anything. Because if this happens, this will not apply to the definition of an active listening. And the angry person will know that. And the situation will be worse here. And you can lose the control again and lose the rapport with the patient. Another point that please do not interrupt them while they are talking. Do not interrupt them while they are talking. Let them finish. Let them say what they want to say, and then you can catch yourself back and you can respond back. But while they are talking, please try to not interrupt them at any point, regardless what have been said to you. The next step, after you know the circumstances of the event and the circumstances of their anger, now we have to demonstrate an empathy. The very important point. Point number 2 is empathy. What we mean by empathy. Empathy, it is a totally different from sympathy. They look similar, but they are not, in fact. So the meaning or the definition of empathy is the ability to understand and share the feeling of another, while sympathy is a feeling pity and sorrow for someone else's misfortunate. So those are the definitions of empathy and sympathy, which are totally different. So how can we demonstrate empathy? What are those steps for empathy? So empathy including 4 steps. Point number 1, that we need to repeat what have been said or repeat the concern that we got the message. We need to paraphrase it. The same thing, we'll just paraphrase it in another phrases so that we understand the point. And point number 3, that we need to understand the feeling of this person, and we have to validate it and we have to believe it. So those are the steps of empathy. So after you demonstrate an empathy, believe me, things will be totally fine. And the situation now, it is totally under your control without any difficulties if you followed those steps. So this is the during part which we talk about, that we have to introduce ourselves, and we have to prepare the situation, and we have to invite the patient to the calm area, and we need to gather more information and to figure out the main problem and the main concern. And we show an active listening, and now we are showing the empathy after we understand the main problem and the main concern of the patient. Now the patient is calm enough to go to the next step or to the final step, which is post. This is the third and the last part. What we mean by post? Post meaning what? Post is the fixation of the problem. How to fix the problem. Because now, initially, the patient was angry, and you tried to contain that problem, and you did well up to this point, and things are fine and under control. The patient now is no longer angry. So, but you have to provide the patient with the full management plan and the full fixation of their concern, full fixation of their problem. Because if you just stop doing anything at this point, believe me, again, the patient will become much more hostile than before. And at this point, it will be very difficult for you to control it. So the last part, which is the post, is the fixation of the problem and sharing the management plan with your angry patient. For example, the patient has been waited long time without being seen. So this is a concern of the patient. The patient is angry because of this reason, that have been waited long time without being seen. So here you have to apologize for that after you demonstrate and your empathy. After you apologize for that, what is the solution? You have to explain to the patient what is the solution. I will give an example. This patient had been waited for 3 hours, 4 hours without being seen. And now, because you are handling the emergency, and the patient will wait for 1 more hour to be seen. After you demonstrate all these steps and you absorb the anger of the patient, yes, the patient will be able again to wait the same time he waited before, because you follow a very nice approach and you follow the good steps and you absorb the anger and you address the concern of the patient. Meanwhile, or on the other hand, if you didn't follow the good step to absorb the anger of the patient, believe me, will not be able to wait for even 1 more extra minute. But like this, the patient will be on your hand. You can move it to the right, to the left. But you have to share the management plan with them clearly, okay? With a specification of all the details. And at the end, just tell them, I will come back to you shortly. And if you need anything, please, you can find me in the ER. I'm accessible. If you have any concern, if you have any questions, please approach to me. Do not hesitate. I will be more than happy to answer all your questions. Did I answer your concern? Did I fix your problem? Is that okay with you? And then ask the patient if they have any more questions, and answer all their questions appropriately. And like this, we conclude all steps of managing an angry patient. So I give here general scheme instead of talking in each problem individually. So like this, you have a scheme, and this scheme can be demonstrated to fix or to make a resolution for any problem appearing in the ED as usual, because all patients, as we said at the beginning, they have specific concerns, and different type of conflicts can appear in the ED. So let's recap. So we divided the approach of managing hostile patient in the ED into 3 steps. Step number 1, pre-part. Step number 2, during. Step number 3 is post. And we talked that the pre-part is mainly for preparation, two types of preparation while you're coming to the shift and when the problem or when the action took place, and during part things which should be done during the fixation of the problem or during handling the effect or handling the situation itself. And the last one is the post, and post mainly for the resolution and fixation of the underlying cause with clear phrases and words, and answering all the questions appropriately, and providing the patient with, or the angry person in the ED, with the full management plan and full fixation of the problem itself. And next time we can talk about the communication tips which can help us in such situation, like nonverbal communications or nonverbal communication skills. Plus, we're going to talk about things which has a deleterious effect which need to be avoided, and other communication stuff which has the benefits which need to be used. So like this, we conclude our session regarding the dealing with angry patient. Hopefully you will find it very useful, and thank you.